Hello, and welcome to Strategies for Improving Data Quality on your APR and CAPER. The purpose of today's training is to help CoC and ESG grantees understand the ways that data quality impacts the APR and CAPER, to review sample data quality issues and their solutions, and to learn how CoCs and ESG recipients can leverage data quality improvements in community planning and evaluation efforts. The topics we will cover today are: who is the audience that should be viewing this webinar and why? What is data quality? What are the data quality impacts to APR and CAPER, with examples of issues and resolutions to those issues, leveraging data quality improvements locally, and next steps and additional training opportunities. This training is targeted towards CoC staff and collaborative applicants, CoC program recipients, and ESG program recipients and subrecipients. This training may also be beneficial for HMIS leads or system admins and HMIS vendors. If you have not already watched the Intro to the APR and CAPER video, we recommend you do so before continuing with this training. Data quality is incredibly important to APR and CAPER reporting. It's also important to remember that data can only be corrected and improved inside the HMIS. Data cannot be directly corrected within the SAGE HMIS data repository. When we talk about data quality, we talk about it in terms of completeness, accuracy, timeliness, and consistency. Completeness is the degree to which all required data is known and documented. Accuracy is the degree to which data reflects the real-world client or service. Timeliness is the degree to which the data is collected and available when it is needed. Consistency is the degree to which the data is equivalent in the way it is collected and stored. Why does data quality matter? Some reasons that it matters are: 1, because anecdotal evidence is no longer good enough. Your funders need data as proof of effective performance and accomplishing outcomes. 2, limited funding and greater community need means projects have to compete for funding and be more efficient with their hard-earned dollars. 3, provable results and evidence of best practices are critical funding criteria. And 4, data quality means integrity. And integrity in your data empowers you to use data to drive local planning and performance efforts. We are going to jump into the data quality impacts to the APR and CAPER, focusing on specific HMIS data elements and various results we see from HMIS that impact the accuracy of APRs and CAPERs. We also will reference different HUD Exchange Ask a Question, or AAQ topics, that have helped inform the guidance you get from HUD on this webinar. We will discuss data quality impacts in terms of the 4 ways data quality is assessed: accuracy, completeness, timeliness, and consistency, as highlighted earlier in the slides. In the following slides, we've isolated each data element or data quality issue and included all the data quality assessments upon which that element or issue touch. Correct project types ensure accuracy in reporting. Incorrect project types affect data collection requirements, funder reporting, upload validations, and more. Project typing is the building block to APR and CAPER success. The HMIS program manuals for the CoC and ESG programs describe the specific project type information for each funded component, so please check all project types against the manual. If the project type in your uploaded data doesn't match the information in SAGE, your upload may be returned as unsubmitted. Operating start and end dates are critical for accurate reporting. Remember, each APR upload pertains to the operating year of the funded grant, and each CAPER upload pertains to the recipient's program year and captures aggregate data associated with all active grants. Remember, too, that for APRs, grant extensions change the operating year end dates. Given all this, it is important to work with your HMIS leads and/or HMIS vendors to ensure your upload contains data relevant to the operating year on which you are reporting, because each HMIS software vendor may have particular rules about how to set report filters appropriately and perform project setup accurately to ensure the correct operating start and end dates match the data being exported from HMIS. Question 5 is a critical table in both APR and CAPER reporting. The validation rules set up in SAGE to reject uploads if counts between questions aren't logical are an excellent tool in ensuring accuracy not only in the reporting, but in your local HMIS too. Remember how we mentioned the fact that data cannot be manipulated in SAGE at all? It has to be fixed in HMIS and a new upload produced if there are to be any fixes to the upload file. Therefore, as SAGE checks that, for example, person counts in question 11 or age must equal question 5-1, total number of persons served. If it is incorrect, SAGE rejects the import and you have to fix the local HMIS data to ensure counts are accurate so that files can be uploaded again. This improves HUD's data and your data too. For completeness and timeliness purposes, the HMIS reporting glossary includes a set of queries under the data quality framework that are used to assess the missing values of many of the most HMIS data elements. You might be asking yourself, does this mean I can't have client doesn't know or client refused as an answer? No. HUD expects that a small number of client records may contain missing values in the form of client doesn't know or client refused or other, in addition to blank or incomplete values. But as a reminder, regardless of the reason, all partial, approximate, missing, or unknown values, including the choice of other, will be considered missing or unknown for data quality purposes. As a result, your data quality goals should include using the best answer possible whenever collecting data, and to limit the amount of other as a response. There is not a threshold or benchmark for the error rate of missing or unknown values at this time. However, the higher the percentage, the worse it is considered from HUD's perspective. Nationally, the rates are used to determine if data are usable for HUD's purposes. When in doubt, please enter an HMIS AAQ to determine what option you should use when considering using the option of other. Through the AAQ response, HUD will provide guidance that helps you categorize responses appropriately and limit the amount of other responses used. Again, a small error rate is expected, but please try to limit the use of other as a response. As a final note on missing and unknown values, remember that you may be limiting more areas of the report when data goes missing or unknown. Chronic homeless status, designation as a youth, and veteran status can all be impacted by missing values in living situation, date of birth, and veteran status, respectively. Please collect complete and accurate data as often as possible. We have had a few HMIS AAQs regarding annual assessments. Here are some reminders about consistency and timeliness of annual assessment data. It is not the intent of Data Quality Question 4 to count an error for a missing annual assessment for a person who was not in the project when the head of household had their first annual assessment completed. The programming specifications will be updated soon. We advise you to use your best judgment and discretion in resolving discrepancies between the date you conducted the annual assessment and the actual date the annual assessment should have occurred. The window for timeliness is plus or minus 30 days from the one-year anniversary of the head of household project start date. Question 20B, stayers who have not been in the project long enough to have an annual assessment should indeed be counted in row 5, data not collected. Any client for whom data was not collected for any reason will be counted in row 5 for question 20B. HUD understands that this will include people who have not yet reached a length of stay in the project that an annual assessment is required for them. Remember, the ESG Homeless Prevention Program has a 3-month reevaluation requirement. We talked briefly about the special populations already and the impact of missing data. As a reminder, HUD has recently released the client-level system use and the length of time homeless report as a resource that may be helpful for communities to use to document chronic homelessness in HMIS. This report is intended to serve 2 general purposes: consistently and systematically generate third-party documentation for a client's time in outreach, shelter, or safe haven projects, as confirmed in HMIS, and to provide an overview of an individual client's HMIS history that may improve accuracy of responses to the living situation data element at project start. Squares Access can help you validate veteran status. Connection with RHY and YHDP grantees can help connect your data quality to other verifiable sources of the youth population. Here's an example of where some extra data analysis may help increase your data quality overall. If you've never done it, give it a shot. Run the APR or CAPER for several years in a row and compare the number of clients served, or any other number you like really, from one year to the next. Has anything changed? Are there drastic increases or decreases that don't match funding level decreases or increases? Take a look at your annual budget and overall count of people served. Do some rough math. Does the cost per client per year, depending on your client numbers and budget numbers used, make good financial sense? Just like the last example, do they change over time? Remember to leverage your data quality lessons locally and to leverage local data quality efforts for your APR and CAPER reporting. This means CAPER and APR data can be used for performance monitoring and funding decisions, use the project rating and ranking tool during the CoC competition, run your data at least monthly, and create a data quality monthly plan. Here are some additional resources. Thank you for attending this training. Have a good day.